So, Dr. Bilski, I got a buddy who had the breathing mask, CPAP, whatever they call it. It did not look comfortable. I'm so happy I don't have to wear one of those, even though, I don't know, I do a little snoring, so maybe I should, but that's a conversation for another day.
We'll talk about it a little bit right now.
But I know he's got some problems, and I know you know like the three most common problems with those masks. What are they, real quick?
The most common problem is what doctors call non-compliance. That means, hey, you got to wear this Top Gun face mask.
It's like Maverick up there.
And some people are just claustrophobic about that. And even in our dental world, when we're getting close to working in teeth, people have a little bit like, it's a little creepy. So you have to wear a mask that has a hose on it and straps in the back of your head and neck.
One problem is people just aren't doing it.
They're not doing it because they're claustrophobic. So that's the real problem. The other thing is that they're somewhat noisy, and a lot of times, if you have a sleeping partner, that sleeping partner either requests that you go into another room and wear your CPAP. Now, if you're married, you sleep with your partner. Usually, I
was going to say they're probably really not a sleeping partner; they're an upset partner who's really
right. And it's a proven
not happy.
Fact that for somebody that snores, their sleeping partner actually loses anywhere between 1 to 3 hours of sleep per night.
Keep that. That could be my wife.
And there are different levels of snores. There are postural snores. They're just more of a snore. They're not sleep apnea. Yeah. When you have snoring with sleep apnea or hypopnea, you're either holding your breath or your sleeping partner actually witnesses an episode where I'll try to imitate it, but you're sleeping and you're looking at someone, they're just not moving. Then all of a sudden, and it is the noise that you are just like, what just happened?
Okay, so we got number one, people don't use the thing. Number two, they kind of do use it, but it's so loud and the snoring.
It's loud, and the other one most likely is if you're a side sleeper and you wear the mask and you turn to the side and it kind of kicks over. So it's half on, half off, but it's not working. What it's trying to do, this mask, is pressurize the air and push it through your nostrils and your mouth to have it pumped in so that you get air. Not oxygen, just the natural air that's around us.
All right, so a bunch of problems with wearing a mask. What's the alternative? What are you going to do if you got this? If you got this condition?
Prior to what we're currently providing in our office is if you were non-compliant, you couldn't wear the mask for a lot of reasons. And some of them they're not going to do it. They get it. They put it in the closet and they never wear it again. Doc, I still need it. I'm snoring. My wife's killing me. I can't take the elbow to the side of the ribs anymore because it's not nice anymore. It actually hurts. All right, so how about if we make you an oral appliance? It's called oral appliance therapy, OAT. All right, these contraptions are ridiculous. So any appliance, I should say almost every appliance that I make for myself just to see what it feels like.
And it's not pleasurable.
It's not cool.
Well, I mean, anything you're trying to sleep anyway. Anything it's got to be.
But I get it. When someone says, so I'm a 60-year-old man and I'm getting close to retirement, as an example, and my physician says, you got a bad sleep study here. You're moderate to severe. You're mild to moderate. There are different classifications. Blood pressure, diabetes, heart disease, dementia, all from sleep apnea. It's a contributing factor. So what you're probably going to wear it because you don't want to die.
Sure, but what do you do? What can you do otherwise?
So that's we make these appliance therapies because they tried their machine, their mask, and they don't like it. They don't want to wear it. It's noisy. It's dirty. Most people don't keep them clean like they're supposed to be cleaned. So that's an issue. So you try these oral appliance therapy gadgets, which can be expensive. They can be as cheap as $1,900 up to $6,200. So, okay, now what do we do? Well, Dr. Schiffman, who's out of Boynton Beach, Florida, has developed this therapy over many years. I think he's been working on it for 13, 14 years now, where he's actually figured out how to utilize the lasers to aim at underneath the floor of your mouth, meaning underneath your tongue, your cheeks, your soft palate, your tonsillar pillars, which is on either side of that punching bag, the uvula, in the back of your throat.
Yeah. What are you doing when you laser?
So the principle behind the laser is that we call preheating the tissue, meaning warming it.
Right.
so that the body is going to receive a different type of laser that helps to increase collagen stores and tighten that tissue.
So that's what it's about. So ultimately, it's just going to tighten it.
It's a tightening. So as we get older, mature, we start to lose the tonicity of our neck muscles, our palates, our tongues. They're just not like they used to be when we were younger men and women. So what can we do? Well, we use the lasers to help not so much shrink, but tighten. And we talked about tonsils, how we can shrink tonsils as well. Yeah. That's kind of what we're doing with this.
Pretty neat.
And we're seeing some pretty decent results even after the first appointment. So somebody that is definitely been diagnosed with sleep apnea or hypopnea that is maybe wearing a CPAP or a BiPAP mask, or has worn it and is no longer wearing it. They maybe have tried the oral appliance, or they're not doing it. They'll do the laser therapy, and what we're finding is we're not making any oral appliances anymore. So that's a savings right there.
That's great.
It's more comfortable when you sleep.
Yeah.
A gentleman in particular, he's 50, but it's lifestyle that we have to consider too. So if you're 50 and you smoke, and perhaps you partake in alcoholic beverages. I'm not saying alcoholic level, but he's a salesperson that entertains a lot. Yeah. So he's smoking, drinking, and he's 50. So for every decade you're on this planet, we're going to recommend 1 appointment. So if you're 50, that's 5 appointments.
So 5 appointments will get everything tightened up a little more, so it's helping me out with my breathing.
And then if you're a smoker, we're going to add an additional. Okay. So now you're at 6, and we're asking for honesty. And transparency. Like, do you also partake in beverages more than 2 or 3 a week?
This is a great procedure that can help you, not have to wear the mask and do all that. So be honest, because you want it to work, and that's how it's going to work.
So we're going to do minimum of 3 with everybody.
Okay.
And if someone says, well, can you just try it one time? No, I can't, because I don't know your lifestyle.
Yeah, right.
I'm not hanging out with you. So it's going to be 3 treatments. If you're 50, we're going to go 2 more. And then any lifestyle that we know that you partake with, we're going to ask for an additional. So this gentleman we're doing 6 for sure, minimum. And we're going to leave it open-ended. Do you think you need that 7th one? And then the follow-up would be, being in the dental practice, we try to do these around your cleaning appointments too. So if this gentleman wants to come in and he doesn't want anybody to know what's going on, and he can come in the anonymity within my dental practice.
I'm just going to the dentist.
Going to the dentist, get my teeth cleaned. And so what we've gotten feedback from the wives in this case, it works.
And who would have thought a dentist could help with your snoring, possibly? I mean, that's pretty neat. So, hey, if somebody's watching right now and they want to learn more, is there something on your website that they can?
Yeah, there are quite a bit of things. The best way to do it too is, because you're not going to get the full scope, is just go to the website, click the box, schedule an appointment. It's complimentary.
Yeah. Okay.
And then we have a bunch of other things too. We have books with QR codes, and we're working feverishly right now on that to get that uploaded. What my goal is for my website and within my practice is to get the information out to you all, that you can just go onto a QR code or click a box and see maybe a minute, 2-minute, 3-minute video on what actually happens.
Yeah.
So when you come in, it's like, I don't have to go over everything. And then the questions are, how much does it cost? How long does it take? Does it hurt?
Yeah, get down to the business.
So really we can just get to the point, like, okay, do you smoke? Yes, I smoke. Do you drink? No, I don't. Okay, so you're 30, you're going to need 4 appointments.
That's beautiful. What more can you need?
Yeah, when can I start?
You know?
Do I need the appliance? No, I don't need the appliance. We are going to ask you, though, within these consultations, if you are truly a CPAP wearer, you already had a sleep study. I would like to see that most recent sleep study.
Okay.
And then what we're going to do is we're going to start from that date, do the therapies, and then I would request that you go back to your physician and have another sleep study. Now, sleep studies are getting a little bit better. They're not always having you go to a sleep facility or a clinic, which is not the same sleep that you have in your own home. So the home sleep studies are getting pretty good.
Good.
So we could use that too, but my point is we could make a comparison. So if you had a sleep study in a clinic, we're going to ask you to go back to that so that we have a true constant. Like, oh, you were at the clinic? Yep. Okay, this was your number. Now you've had the 5 treatments due to your age. You don't smoke, you don't drink. And let's go back and have Dr. Smith take a look at you. Have him or her call me back or send a note that explains the findings. And if you'd like to discuss how we were able to achieve this with Randy, then why don't you give me a call and I'll meet you for lunch.
It's pretty neat.
Yeah, so we need help from our physicians. Now, if you come in and you don't have a sleep study and you know you do snore and your wife said that she did witness an episode, I'm still going to say, hey, look, please go to the doctor because I'm not going to treat something that I don't know what I'm dealing with here.
Right.
If you're just a snorer, different story. We can help you right away.
All snorers are welcome in the chairs at Bilski Dental's office.
As long as you're awake and not sleeping when you're there.
So the only thing that's left to do is head to the website if you're not already there, bilskidental.com.